Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. Today I'm going to talk briefly on Bell's palsy. It is a very common clinical situation that we encounter and acute onset of the weakness of the facial muscles of unknown cause. It's an unexplained episode of facial weakness, less common before the age of 15 and after the age of 60. Males and females are equally affected. And diabetes, pregnancy, viral infections are supposed to be the risk factors. Some of the risk factors, as a matter of fact. It is not a permanent weakness of the facial muscles. Most of the patients with the Bell's palsy, they recover over a period of 3 months to 6 months following onset. Well, recovery begins in 2 weeks to 6 months after the onset of symptoms. Most of the people, they gain normal power of expression. A very common condition, it is said 1 in every 60 persons get at least one episode in their lifetime. Okay. What are the causes? As I told you, cause is not known in most of the cases, but there have been proposals for some of the risk factors. That is diabetes, obesity, exposure to cold, autoimmune phenomena, lack of sleep, sleep deprivation, hypertension, stress is one of the causes. Previous episode of Bell's palsy, like immunocompromised state like HIV, and there have been observations that viral infections may predispose to this clinical situation, like herpes simplex, varicella zoster, Epstein-Barr virus, and COVID-19. Well, when you look at the patient now is subject to the inflammation and edema, thereby resulting in compression injury during its course to the bony part of the temporal bone. That is petrous part of the temporal bone. And the common age group is 15 to 16 years, 60 years. Around 40 years, you encounter most of the cases. Well, how do the present and is the Bell's palsy is a serious condition? It's not a serious condition. Most of the patients they get back to normal facial expression. Sometimes facial paralysis could be a part of the serious condition that is stroke. When you get sudden episode of weakness of one half of the face and you are unable to show any expression, and that is voluntary expression, when you are unable to smile, when you are unable to close your eyes and your face looks twisted with the drooping of the one half of the face, you will be scared. Most of the patients they are afraid of that they may be suffering from stroke. They suddenly rush to the emergency saying that I am quite okay when I went to sleep last night. When I got up in the morning, my face looks awkward. Doctor, help me, what happened? This is the way the patient approaches the emergency services. But it is nothing to worry about this particular situation. Explain and counsel the patient saying that it is an injury to your facial nerve, secondary to inflammation and swelling, and nerve suffers from a degree of compression during its course into the bony canal of the petrous part of the temporal bone. Okay, and but there are certain symptoms by which you can say that facial weakness could be a part of the stroke. When when the patient experience numbness in the limbs, then you can doubt the situation could be a part of stroke. Besides, if there is weakness in one half of the body and there is visual disturbances and diplopia, indicating that there is extraocular muscles are involved due to the involvement of the other cranial nerves like absence nerve, and the patient develops seizures and there is memory loss, there is aphasia, that is the patient is unable to speak, and there is hearing loss that shows the involvement of the vestibulocochlear nerve, and loss of balance. That means either vestibular part of the vestibulocochlear nerve or cerebellar tracts involvement. If there is vertigo or headache, presence of any of these symptoms may indicate the present situation like Bell's palsy or the facial weakness could be a part of stroke. So clinical evaluation, clinical examination is so important in order to confirm the diagnosis of simple Bell's palsy. Then what are the symptoms of Bell's palsy? Bell's palsy is the sudden onset of weakness of one half of the facial muscles. Okay, resulting in drooping of one half of the face. Sudden loss of voluntary expression due to weakness. That means there is voluntary expression of the facial muscles is lost, but emotional expression is intact. Patient is unable to wrinkle the forehead, difficulty to close the eyes, absent tears, absent nasolabial fold, drooping of the angle of the mouth on that side, there is drooling of the saliva, loss of taste in the anterior two-thirds of the tongue, there is a sense of ringing in the ears and increased sensitivity to sounds. Patient feels heaviness on the face on the affected side. Sometimes there could be pain and fever, pain at the angle of the jaw and headache, and fever a day before preceding the symptoms. Well, look at this picture showing the facial nerve palsy. There is inability to wrinkle the brow. The affected person may not be able to raise one eyebrow or wrinkle the forehead on one side. This is due to the weakness of the frontalis muscle supplied by the facial nerve. And drooping of eyelids, inability to close the eye. This is because of the weakness of the orbicularis oculi muscle, which receives the signals from facial nerve. and the dryness of the eyes, because lacrimal glands are supplied by the facial nerve, and there is loss of function of the lacrimal gland results in the dryness of the eye. Asymmetric smile. When the person smiles, the affected side of the face may not move as much as the other side, resulting in an uneven or lopsided smile. Okay? This is because of the weakness of the orbicularis oris, innervated by the facial muscle, facial nerve. Then there is a drooping corner of the mouth. The corner of the mouth on one side may droop, okay, and there is a drooling of the saliva on the same side. This is again the weakness of the orbicularis oris muscle, okay, innervated by the facial nerve. If you test for the taste, there is loss of taste in the anterior two-thirds of the tongue. Otherwise, patient is normal, able to walk normally, gait is normal, sensory system is normal, except the motor weakness of the one half of the face and dryness of the eyes and loss of taste in the anterior two-thirds of the tongue are the only manifestations of Bell's palsy. Okay? And diagnosis is confirmed by the history and the clinical examination. And in the absence of sensory loss in the extremities, with the gait being normal, okay, there is no motor weakness in the extremities, and speech and the sensorium is normal, and there is only loss of voluntary expression of the facial muscles. It denotes it's a case of lower motor facial nerve palsy involving the isolated facial nerve, probably near the petrous part of the temporal bone during its course through the facial canal. Okay, because it innervates the stapedius muscle. Weakness of the stapedius muscle results in the increased sensitivity to sounds, and it also innervates the anterior tooth and the tongue through the chorda tympani branch of the lingual nerve. There will be loss of taste sensation in the anterior two-thirds of the tongue. With these features, Bell's palsy diagnosis is complete. But you do the CSF analysis to rule out the meningitis, do the CT brain to rule out the intracranial lesions, okay, and do the electromyogram in order to understand the facial nerve conduction velocity, by which we can predict the degree of recovery during treatment. Then treatment includes eye care with tear drops. Then do the eye shield during night time to avoid injury to the eyeball, and start the steroids as early possible, which will reduce the compression injury secondary to inflammatory edema. Antiviral drugs are given like acyclovir, as the herpes virus is supposed to be a causative agent causing the nerve injury secondary to infection and inflammation. Electrical stimulation and finally plastic surgery is done in order to correct the facial appearance and also enhance the recovery of muscular contraction and voluntary expression. So this is how the patient with Bell's palsy is managed, and most of the patients they recover over a period of 3 months, and very few they take longer time for recovery. The factors that are responsible for delayed recovery could be complete total facial paralysis above 60 years of age, and individuals who present with a loss of taste and salivation they take longer time for complete recovery. Okay, well, this is a brief talk on the most common condition that is the Bell's palsy, a lower motor neuron lesion of the facial nerve in the facial canal of the petrous part of the temporal bone during its course before it exits through the stylomastoid pramina and innervate the muscles of voluntary facial expression. Yes, it also innervates the lacrimal gland and the salivary gland. It may present with the dryness of the eyes and dryness of the oral cavity. So, well, these are the clinical presentation and the treatment line for the patient with Bell's palsy. Thank you very much for patient listening, and we'll meet you again in the next class. Until that time, bye bye and thank you.